apnea. Then we're talking about tips to help the bed partner, for example, go to sleep despite the snoring. But if it is that there is some underlying sleep apnea there, it's something that we should really, if you say, oh, okay, I'm not sure if I want to have a sleep test, is there any way I can gauge? I would say, well, if you're snoring and you sometimes have sensations that you wake up at night, you're not sure why. If your partner says, you know what, you were snoring and then it seemed to be really quiet for a while and then you started snoring again, that could mean that there have been some causes that happen in your breathing. If you're snoring and you're just waking up tired, then that could mean that it's more than simply snoring.
And now, is there a particular age that snoring can, begin? Does it happen at a certain age where, like, okay, you start snoring, the muscles get a little bit weaker or more relaxed?
So, not for everyone. So if you're thinking about what's the high risk for developing snoring or sleep apnea, age is one of those risk factors we talk about where, as you said, as we get older, we naturally lose some tone in our muscles, so then you have more collapse. That collapse can then lead to snoring, vibrations, and then you have sleep apnea, right? But there are some patients who would tell me, I've been snoring since I was a child. And then it may be an issue of your anatomy, the way that your jaw is set, if you have a large tonsils and large tongue. So many different reasons why you can have it, but you can have snoring from childhood.
And now, I think the big question that I have is, does snoring lead to sleep apnea? And what is sleep apnea?
So snoring potentially can lead to sleep apnea, and that's where we're talking about who's at risk and who's not. Right? There are risk factors we can control, and there are risk factors that we cannot control. So for example, if you have somebody in your family who snores or who has sleep apnea, then you yourself are more likely to develop snoring or sleep apnea. We mentioned age. Actually, as we all age, we have that loss in tone that can happen. And we also have gender. So men are 3 times more likely to suffer from snoring becoming sleep apnea than women. But there's a bit of a difference. So the difference there, we're talking about a difference in risk in premenopausal women. Once a woman goes through menopause, she's now just as likely as her male counterpart to have sleep apnea. And there have been studies that have been done on this to figure out why. And we believe it's because of our hormones. So in a woman's body, we have estrogen and progesterone, and that has been shown to have a protective effect. It helps to keep our airway open. During menopause, those hormone levels drop. Right? So when they drop, then we become more susceptible to collapse at that point. So something to keep in mind if you say, you know what, I've been a great sleeper all my life, then you hit menopause and all of a sudden you're not sleeping well because estrogen helps with your deep sleep and your REM sleep. And my husband says I'm snoring, my partner says I'm snoring, what's going on? Your hormone levels may be accountable for that. So those are some of the non-controllable factors, but there are things we can control too. Obesity is one of the kind of biggest factors that we talk about. And when we talk about that, we're talking about weight gain, but not everyone who gains weight gets sleep apnea, right? We all gain weight distributed in different areas. So if you know that you gain weight in the neck area, your tongue, you actually gain weight in our tongue as well, the abdomen, then you're more susceptible to sleep apnea because you're putting more pressure on your back front. We talked about alcohol, lying on your back. When you lie on your back, your tongue can fall back, block the airway. Smoking can irritate the tissues as well. So those are just some things to think about if you're trying to figure out ways to control, or at least prevent all the risk.
So I think maybe defining what is sleep apnea. So first of all, how do you know you have it? And then what are the repercussions of having sleep apnea? What other diseases and illnesses can it lead to?
So sleep apnea is pretty much, I'm referring to obstructive sleep apnea. There are different types. The most common is obstructive. So obstructive sleep apnea is the point at which your airway is closing in or collapsing. And what happens there is when your airway collapses or obstructs, that leads to a decrease in your oxygen levels. So when your oxygen levels go down, your brain becomes hyperexcitable. And that hyperexcitability now leads to this stressful activation of all of your systems, your heart, your lungs, your metabolic system. And that stressful overdrive continues until your airway opens up again. So when your airway opens up again, things calm down, but then the cycle starts again. And there are some people who may have this cycle happening anywhere from 5 times per hour to over 100 times per hour. So you may find some people waking up exhausted, right, because of this. But when we're talking about that strain, it's happening night after night, and this is over a long period of time, right? That strain can have health consequences like high blood pressure. And high blood pressure, that's kind of difficult to manage or control with medications or multiple medications. It's because of the apnea, right? Abnormal heart rhythms, heart attacks, strokes, diabetes. And we're seeing more studies now showing that because our brain pretty much needs oxygen, right, to maintain that good cognitive function and ability. So if you have sleep apnea, your brain is constantly being exposed to these low levels of oxygen. We're thinking now that there is an increased risk of dementia as a result of it. So there are consequences, and these are just the physiologic consequences in addition to just being fatigued, not being able to live your best life, right? That we do have to think about and acknowledge so we can treat it and get on top of it as soon as we can.
And so what are the treatment options for somebody who has sleep apnea, like a severe type of sleep apnea?
Yeah. So when it comes to treatment, I get a lot of questions about weight and fitness, right? And the question usually is if I were to alter my weight, optimize my fitness levels, will that help to eliminate snoring and sleep apnea? What I would say to that is that weight and fitness don't necessarily have to cause sleep apnea. But if you're not at your healthy weight goal or your optimal fitness level, it's not helping. So yes, you can potentially use that as a treatment, depending. This is a conversation to have with your doctor, right? Depending on the severity. But what I find is that I do have some patients who are eating well. So they're very motivated, right? Because they want a lifestyle option. So they're eating well, they have a good exercise plan, but they're not seeing the pounds come off. They're not seeing that change in their body. And the reason why that is happening is because the apnea is still there. It's not being treated. So what happens with the apnea, you've done all the work that you should do during the day, and then you go to sleep. And now sleep is needed to metabolize and burn off those extra fats and sugars. But because of sleep apnea, it's disrupted that process. So now instead of breaking it down, you just end up storing it. The other thing that sleep is needed for is to regulate our hormones. Sleep apnea, again, disrupts that. And we do have hormones in our body that tell us when we should feel hungry. When you have sleep apnea, those hormone levels go up. So now you're snacking and feeling hungry even when your body is actually not. We also have hormone levels in our body that tell us, okay, it's time to stop eating. With sleep apnea, those hormone levels go down. So now you tend to eat larger portions, you're overeating. So all of these things can contribute to weight gain or just not seeing progress. And that's where I say, you know what, let's treat the apnea while you're working on these lifestyle modifications, and then hopefully we can get you off the treatment because you'll actually be successful with that. So treatment options. You have, and a lot of you may have heard of, or know someone who uses a CPAP machine. And the CPAP machine pretty much is a mask that you wear when you're sleeping at night. The traditional ones go over the nose and mouth. They have smaller ones now, right? That just go over the nose, or just to the nostril, and they're just as effective. And it goes to a machine that's about the size of an alarm clock, sits on your bedside table. And that machine is not giving you oxygen. All it's doing is it's just adding a bit of gentle pressure to the air that you're breathing in. So now your airway is able to stay open. Every breath is a good deep breath. Now your body can actually rest. So first line recommended because it's the most guaranteed to work. Now, you do have some patients that they've tried their best and they're not able to tolerate it. So that's where we talk about alternative treatment options. I call them alternative because they're not as guaranteed as the machine is, but something is better than nothing, right? So the alternative treatments will be a mouth guard. That you can get from a dentist. It should be custom made because what the mouth guard is doing, you're sleeping with it at night, it brings your lower jaw forward so it will pick up your airway. Because you're moving your jaw forward every night, that's why I say have a dentist who has experience with this, so you're not creating new problems for yourself. The other option is a positional device. Now this is for anyone who specifically snores on their back or who has sleep apnea only on their back. So it's an inflatable that's on your back and it mechanically prevents you from rolling onto your back. So you sleep on your side, and that in itself could be a treatment for sleep apnea. Another treatment, and this is the newest treatment that we have in sleep medicine now, it's called Excite OSA. So this is for patients who snore and who have mild sleep apnea. And the interesting thing about this device, or what's exciting for us, is that this is a device you use when you're awake, not when you're sleeping. So you place it in your mouth, and what it does is it transmits these electrical impulses. It's not painful to the muscles of your tongue. And we use it once a day, 20 minutes, every day for 6 weeks, and we have seen a significant improvement in the tone and the endurance of the muscles of the tongue, so that when you're sleeping, your tongue is no longer going to fall to the back of your airway to block it or cause vibrations. It's toned so it stays up and out of the airway. So that's the most exciting kind of intervention we have now. And beyond that, we're looking at surgical therapies. That could be surgeries of the tongue, tissues around the tongue, surgeries of the jaw. Now, this is still within the alternative world, so it's not guaranteed, and there's surgical risk now. So that's where we recommend having a procedure called sleep endoscopy done to see if you're a surgical candidate or not.
And that was going to be my next question, but before that, I was going to ask a little bit more about the device that prevents you from rolling onto your back, so this way your partner doesn't have to kick you to you stay on your side.
Exactly.
And is that one of the reasons why sometimes when you're with somebody who's snoring, you kind of nudge them so that they turn on their side, because this way the tongue is not falling to the back anymore, it stays, and then the snoring is minimized.
Exactly. We're trying to work against gravity, because gravity is just letting everything drop back. And this is where, the red partner can come in very handy, right? Because either you give a nudge, and it makes no difference at all. So then okay, it's not just on your back, it's on your side, so that's not going to work. But if they say no, as soon as they go onto their side, it's quiet, you can sleep, then the positional device may actually work.
Okay, and so let's talk about endoscopy. That's something that you do at your clinic, right?
Yes, we do.
Okay, let's talk about it.
Sure. So anyone who has a diagnosis of sleep apnea, they would have had a sleep study done, right? And the sleep study basically tells you what you have, and it does not tell you why. You have no idea why you have that sleep apnea. And that's where sleep endoscopy comes in. It's a procedure that we do to simulate sleep. So we simulate sleep with sedation, and it's about a 20-minute procedure. And what we can do is, in real time on the sedation, we can visualize exactly where the obstruction, the vibrations are occurring. And then with that information, now I can have a conversation, right, with the patient to guide them with regards to what are their options, right? Are they a candidate for surgery? Are they a candidate for a mouth guard? We're able to simulate all of those things under sedation. So it's a very helpful tool for anyone who's interested in knowing why do I have sleep apnea, especially if you don't seem to fit the mold of a person who has sleep apnea, or somebody who's tried and true sleep apnea, their back is up against a wall and they need something to help.
And it sounds like it's non-invasive, and it doesn't take, it's like an in and out procedure.
20 minutes. It's similar to anyone who's had a gastroscopy or colonoscopy. I'm on the upper end, but it's similar to that, where 20 minutes, you're under sedation, just to the point where you're snoring, you have sleep apnea. We're able to take a look record and analyze it, and that's it.
And before, there was another question, but I want to kind of backtrack a little bit. You said that, you can do the sleep study in clinic, but now there's sleep studies that you can do at home. Can you expand on that a little bit? Because I think that's very interesting, because most people hate attending the sleep clinic. They would rather do it at home, so, if that's an option.
For sure, for sure. So we have different levels of sleep studies. The one that we're most familiar with is a level 1 sleep study, where you're going into a lab. And the advantage of that is that you're getting fully tested for sleep apnea, whether you grind your teeth or not, are your legs moving, what's your heart rhythm. The problem is you're going into a strange environment, a strange bed, and lots of wires attached to you. So in our effort to get as much information as possible, we get nothing because you weren't able to fall asleep, right? Or the sleep was terrible. So for individuals like that, we have the option of saying, you know what, we can have this done at home. Either we have a technologist come to your home, get you set up. The equipment that we use is not, it's still a lot of wires that you have, but at least you can walk around, you're not plugged in to a wall. So you have that option of saying, okay, I want this in the comfort of my own home instead. I also have some patients where they just can't sleep with a lot of stuff on, a lot of equipment. And they have a specific question. Their question is, do I have sleep apnea or not? So that's where we have a home sleep study called a focused home sleep study. So with this one, you don't have a lot of wires attached to you. It's very straightforward. And the technology now is excellent. The accuracy is on point with the in-lab as well. And that study, we're asking 3 questions. Do you have sleep apnea? How severe is your sleep apnea? Is it positional? And what are your oxygen levels doing during that time? So, it's nice to see patients who've been going for years without any treatment, just sleepy during the day, but because they're not able to go into a lab, they can't really follow with their sleep health, right? So having that option does help a lot of patients move forward with their health.
That's amazing. Before I move on to open the floor up for audience questions, I want to ask you, what are your thoughts on supplementing with melatonin for those people who just feel like they're struggling with sleep? And one of my favorite things is magnesium, just before that. What are your thoughts on those 2?
So melatonin and magnesium, they're not medical sleep aids, right? So because of that, it's not medically regulated. So we don't have definitive statements we can make on it. Melatonin is one of the most popular ones, right? Melatonin, again, it's that sleepy hormone that encourages us to sleep. And when it comes to improving sleep quality, because it's not regulated, cannot make a definitive statement on that. What I would say though is that if you are going to try it, a couple things to think about. One concern we have with melatonin is that being a natural product, sometimes the dose that's on the label does not vary. 0.3 milligrams to 1 milligram, maximum 5 to 10. Around 2 to 3 milligrams, you should know if it's working for you or not. Take it about 30 to 60 minutes before you go to bed, and try to be consistent, because remember, we're trying to encourage our biological clock, so you want that consistency. So taking it consistently can optimize the benefit. I would say avoid in someone who's under the age of 18, who's pregnant, who's breastfeeding, speak with your doctor first. If you're taking medications for diabetes, blood thinners, there can be interactions there. And the other concern is, well, if I'm taking melatonin, am I disrupting my own natural production of it, right? And that is a concern, I'd say, more for younger adults, where we would say, you know what, just take it for a short course, couple of weeks, not too long. But as we get older, our melatonin levels naturally drop. So at that point, melatonin can actually be beneficial, because it's almost like a supplement. We're just trying to get our melatonin levels back up to where they used to be. So those are kind of the guidelines I would give for melatonin if you're thinking about using it, because it can have benefit. We just don't have the evidence behind it at this point. Magnesium, same thing. Anecdotally, I would say I have lots of patients who are using magnesium and they do feel like it calms them. Patients who have lots of twitching and leg movements, calms them down. So I would say just proceed with caution with it. If the supplement says take 1 tablespoon of magnesium, take half. start the work, see how your body responds. And if you are going to use magnesium, I would say use magnesium bisglycinate. That one is the gentlest one on your stomach. If you're going to try.
Well, I can't thank you enough for joining me, for giving us all the information we need about how to get good sleep. I'm sure that everyone in the audience wants to know how to find you. Before I ask for any questions that come up, can you please let everyone know where your clinics are or clinic,
Yes.
and how they can find you?
Sure. So we provide virtual consultations throughout Ontario. So there's no limitation there. Our website is sleependoscopy.ca. One of my staff members, recommendations that we have with brochures. And we do have a booth here. If you're interested in seeing these alternatives, the mouth guard, the XI2RC, it's all at our booth. A video of the endoscopy, if you can tolerate seeing what happens inside of your throat. We do have a real-time video that's there as well. So please reach out if you need our help.
Does anyone have any questions you'd like to ask Dr. Morong?
I just have a comment.
Oh,
My mom's in her 90s.
Yes.
And in the senior center, and she was having difficulties in her 90s day. It was night shifts. Anyway, they gave her a low dosage melatonin. None of her worked. And she's been using it ever since 3 years later.
That's great.
So for her, I do my nephew, no dice.
Yeah. And that's the thing we do, it does work. It does work, but we just don't have that evidence to say less than 90% of patients will, but it can work.
for children?
We would recommend,
Gummies?
yeah, so we recommend not, but avoid it unless you have a conversation with your doctor about it. One, because the gummies look like candy, so you have that risk of overdose with it. And if there is, melatonin is still a hormone. So kids are still growing, their hormones. The last thing you want to do is disrupt their hormonal cycle. It can affect other hormones, their reproductive hormones. So it's not something we would jump to. A lot of times with children who have, and I practice adult sleep medicine, but a lot of times with children who have issues with sleeping, falling asleep, there are behavioral techniques. One is called bedtime fading, for example, that can be used in addition to optimizing their environment. Things that can be done without having to resort to melatonin.
All right, thank you so much, Dr. Morong. Thank you to the audience for attending.
Thank you. I will be able to do a couple of any questions.
I would recommend one that is secret.
Thank you, Claudia.
Introduce you to Dr. Sharon Morong. She is an incredible sleep expert. I'm going to call you a sleep expert. She is from the Sleep Endoscopy Clinic, and we're going to talk about everything sleep. So, make yourself comfortable. I will let you properly introduce yourself and let everybody know exactly what it is you do and how long you've been doing it for.
Sure. So first thing, thank you so much for having me here. This has been an amazing event so far. Just honor to be here and answer your questions as needed. So I'm Dr. Morong, and I'm an otolaryngology head and neck surgeon. I specialize in adult sleep medicine, sleep endoscopy, and sleep surgery. And our center, the focus is to serve and to provide options. So options for anyone who's interested in getting their sleep tested. That includes going to a sleep lab or having it done at home. We provide options for anyone who's diagnosed with sleep apnea. They want a little bit more information about, they know they have sleep apnea, but why exactly do you have it? So we have a procedure called sleep endoscopy where we can kind of further investigate that. And then we provide a variety of treatment options for sleep apnea as well.
So, raise your hand if you're like me and you love your sleep. Okay.
I'm all about sleep. I need sleep. I learned that very early on. I was never one of those students who would pull an all-nighter. I could not party all night. It was just not, I need my sleep. So I think the big question is, what causes sleep disturbances? What causes us not to get into that deep sleep that makes us wake up and feel well rested?
So sleep is we have a holistic approach for it, right? And we're always asking that question, how can we improve our sleep? I break it down into 3 boxes. You have sleep duration, sleep timing, and sleep quality. So if you look at sleep duration, there are guidelines, right, that tell us that we should sleep for at least 7 hours per night. But these guidelines are for society as a whole. It can vary from person to person. So if you're asking yourself, well, what is my magic number, right? Your number of hours that you need to sleep is the number of hours that allow you to consistently wake up feeling rested, feeling energized during the day, and just being able to feel your best. So that's how you kind of ascertain, well, what is my number? Moving on to sleep timing. So sleep timing is where we're talking about circadian rhythm alignment. So circadian rhythm alignment pretty much means that you're getting your body's natural internal biological clock aligned with your natural environment. So our body naturally wants to be awake when it's daytime, and it wants to be sleeping when it's nighttime. If you're able to get your wake time and your sleep schedules in line with that pattern, you will sleep better, you'll feel more alert during the day, and you'll just overall be a healthy person. So how do we get this alignment going? Right? Couple things to think about. Consistency. Our brain needs consistency, it needs structure, it needs predictability. So we start with the time that we wake up. That should be a consistent time regardless if it's during the week or if it's on weekends. But it doesn't stop there with consistency. You have to look at your day as well and try to insert predictable, consistent time points during the day, because that will set you up for a consistent, predictable good night of sleep. So for example, the time you start work, your mid-morning break, when you have lunch, when you start work, when you finish work, sorry. These are all time points that I'd say prior to the pandemic were second nature for all of us. But once the pandemic hit, and then we started working from home, those time points were lost for a lot of us. That's when we lost our ability to sleep as well. So if you're at home for any reason, you're working from home, you're retired, you need to be very intentional about getting those time points through your day to get a consistent night of sleep. The other thing when we talk about timing, we're looking at daylight exposure. That is a really powerful cue for your brain to know that it's daylight, it's time to be awake. And again, pre-pandemic, a lot of us got that when we left home, got outside to get to work. But the minute the pandemic hit and we started working from home, instead of going outside, we were going down to our basements where there are no windows, artificial lighting. Then you have that artificial lighting from daytime to nighttime. So your brain is confused. It has no idea when it should be awake and when it should be sleeping. And again, sleep was affected. So really try, if you're home, open up those curtains, be intentional about going outside to get that daylight exposure. And that's a cue for the daytime. You also need cues during the night as well. Those cues are darkness and cool temperature. Because when you have those cues, that secretes, or at least it triggers your brain to secrete a hormone called melatonin. And that's what I call the sleepy hormone. That encourages us to sleep. So getting the timing right for sleep will help to improve it as well. Then the next box, we have sleep quality. Right? Sleep quality, I would say it's looking at your sleep drive. Sleep drive is the need to sleep. You're feeling sleepy. And that sleep drive actually starts when you wake up, and then it slowly builds up during the day until you get sleepy, and then you go to bed. Now, there's some things that we do throughout the day that might take away some of that sleep drive. Things that we may know about. Caffeine. that much needed cup of coffee in the morning. And there's nothing wrong with having caffeine. You just have to be strategic, right? With how much you have and when you have it. So caffeine, for example, has a half-life of about 5 to 6 hours, which means that if you have a cup of coffee at 4 p.m., 6 hours later at 10 p.m., you still have half of that cup of coffee going through your system. So if you're trying to wind down, that stimulant is there preventing you from being able to fall asleep. And in terms of the amount, we usually say maximum 4 cups of coffee to have, which is quite flexible. But everyone's sensitivity is different, but maximum 4 cups. Now, alcohol, that's another factor. A lot of us have alcohol at night because we are actually using it to wind down, to relax, have that glass of wine with dinner, relax, and hopefully fall asleep. And, alcohol can get you to fall asleep, but the problem is it compromises your sleep quality. So it takes away your deep sleep, you're waking up a lot more at night, so your sleep quality does get affected, so we still try to avoid alcohol if we can. I get the question a lot about naps. Should I like to nap or not to nap? I would say that it depends. If you're a healthy sleeper, you have no issues falling asleep, staying asleep, but you need that boost during the day, it's reasonable to take a nap. You just again have to be strategic, right? Make sure you don't have a nap, I would say after 3 p.m. is pretty late, and maximum 20 to 30 minutes. But if you do have trouble with good sleep, then I would avoid naps because it's taking away that sleep drive that we talked about. So those are just some of the things that we can think about when you're thinking about trying to improve our sleep.
Yeah, I find that interesting because, I'm a good sleeper, but I've also developed my own set of sleep hygiene.
Yes.
But I think the question that I have and I get from my own patients and actually my sisters who aren't here, because we always compare sleep patterns and they're upset because I sleep very well, but if you wake up during the night, but you easily can fall back to sleep, is that actually a disruption to the quality of sleep?
No, it does not have to be.
Okay.
So for us, when we look at sleep and sleep architecture, you may wake up at least 5 times per hour. Sometimes you don't even realize it. Other times you wake up briefly, you go back to sleep. Our gauge for it is how are you feeling the next day. And so if you say, well, yeah, I woke up once, now I went back to sleep, and I was bursting with energy and going through my day, nothing wrong with that at all. If you are waking up at night and having trouble falling back to sleep, or you're waking up a lot and you go back to sleep, but then you wake up and you feel like you haven't slept for the whole night, then that's where you can work on it.
And so what about a person who will, I like to call it flip and flop in their sleep? That has nothing to do with sleep quality, they're just active in their sleep.
So it depends. Now, there are tossers and turners, right? And a lot of times in that situation, they may not even realize they're doing it. It's more the bed partner that's coming to me complaining about it, right? But you do have other situations where someone says, I am not having a restful sleep, and the partner says, well, you're tossing and turning all night long, then you know it could be their legs are involuntarily moving at night. And it could be sleep apnea. Sometimes with sleep apnea, pretty much what's happening when you have sleep apnea is that the muscles and tissues in your throat, they tend to relax. That part is normal. But then when it relaxes too much, it starts to vibrate. Those audible vibrations, that's snoring. That's not a health risk, maybe a quality of life issue, but not a health risk. But when you have the point where your throat starts to relax, where it's now collapsing or closing, that's where you may have leg movements. It's like your legs are giving you a nudge to breathe better, right? And you may have pauses in your breathing, shallow breaths. That's sleep apnea, that's where we get, concerned about health issues at that point.
And that was my next question. Snoring.
Yes.
Let's talk about snoring first, because snoring is a big, issue in a lot of people's lives and partners. If you're complaining about your partner snoring, if you feel yourself snoring, is snoring normal? When does snoring consistently become a problem?
So snoring in and of itself doesn't necessarily have to be a problem. The only true way to know is to have a sleep test, right? The sleep test will gauge whether snoring is just snoring or if there's an element of collapse as well. And snoring, if snoring is happening without